Hello again. Something caught my eye the other day in a study in a recent issue of the JAMA Pediatrics Journal. Reminded me of the time I took my son to this urgent care. Researchers found that in a non-emergency, parents aren't that loyal to their pediatricians, even if they have an established relationship with these physicians. Many of them take their children to the nearest urgent care centers instead because of convenience. These centers have evening and weekend hours. Some are open 24 hours and they take walk-ins. But parents may not know they are relying on a number of things taking place after the visit. For the purposes of continuing care, the family's pediatrician should be provided with details about the visit so that he or she knows the story and the information can be placed in the patient's personal medical record. That means the urgent care center must not only maintain its record of the patient visit, but also provide a report on the visit to the patient's regular physician. Unless an urgent care is part of a larger healthcare system, there are no shared records beyond the clinic sending a care summary to the physician's office after a visit, if one is sent at all. To use one example, a nurse practitioner at an urgent care may give a sports physical exam to your son, not knowing about the 2 concussions he suffered the year before. And despite convenience, parents may never take the child back to that same urgent care center. In that case, we would have an orphan medical record that is incomplete at the urgent care, and a pediatrician record that may not be up to date. Suppose the urgent care center could do some basic medical studies like take an x-ray or a photo of an oral sore or a lesion. Would those find their way to the pediatrician's office? And how soon? Well, we have a technology to provide the pediatrician's office with access to these kinds of records nearly instantaneously. We can capture the data and any images and save all of it to the server that is available to the provider 24 hours a day, 7 days a week. If the technology is there, and if it benefits patients and healthcare providers, why aren't we using it? Look at the banking industry. Adults in their early 30s have never lived in a world without ATMs. Banks were early to adopt electronic records and internet technology. Now, for instance, you can take a picture of a check with your smartphone, I do this, and deposit it in my bank via the photo that I took from my phone. The banking industry has similar concerns about information security, and it's time for medicine to view technology as a resource, not only a potential threat. I'd be interested in knowing what your thoughts are, so please email me. I'm Joel Barthelemy.